And hello everybody, my name is Scott Kopenbarger and welcome to the OU Medicine Chat. I'm joined today with Dr. Laurence Rubenstein, who is the chairman of the Department of Geriatrics at the University of Oklahoma School of Medicine. Thank you very much for joining us today. We're going to be talking about senior issues, particularly when it comes to the medicine that seniors are taking and how the whole family is involved in this process. I thought it was a very interesting fact that we first came across here was that when you're talking about people and when they're talking about the medicine intake, we see that more than 1 in 4 Americans do not take his or her medication as prescribed. And I started wondering, is that the same statistic for senior citizens?
Well, it's hard to get these statistics accurately, but from what I've read, that is probably a low figure for seniors. Seniors are, on the whole, take many more medications than younger patients because of accumulated chronic diseases that happen as we age. And an average older person has about 6 to 8 prescribed medications. Some have many more. In addition, they're taking over-the-counter medications, vitamins, other things, so that if you look at the entire spectrum of medications, you often get into the 20s or 30s sometimes. So to take that...
20 or 30 different medications.
Yes. So to take that accurately is almost impossible.
Mm-hmm.
So it's really important, especially in the senior population, to simplify the regimen wherever possible, to work with the physician and the pharmacist, to do what's called a medication reconciliation,
mm-hmm.
to get the number of medications and the potential interactions down to the bare minimum. That in turn will improve ability to take the medications properly.
Mm-hmm. So indeed, it does take a village basically to manage prescriptions as we get older.
Right. Everybody
is involved in the process, not only the medical and the pharmaceutical professionals, but the family too, and we'll be talking a little bit more about that. Let me first ask folks that you participate in today's chat. There's several ways that you can do that. To the right of the screen, you can submit an email question, but the easiest way basically is at the bottom of your viewer. Just go ahead and submit a question. It'll come to me and then I will relay it to Dr. Rubenstein. When we talk about these 20 or so prescriptions, obviously the risk for danger increases. What are the dangers of drug interactions, or if we're not taking our regimen correctly?
That's a good question. There are different types of problems with medications. There are many medications where it's crucial to take them as prescribed. If you're supposed to take them every 8 hours, every 6 hours, it's important to take them as prescribed with slight tolerance is often permitted, but most of the time it's really important, particularly certain medications like heart medicines that are controlling a heart rhythm, antibiotics that need to maintain a certain blood level to be effective, anti-seizure medications that's important to maintain blood levels for. So those would be crucial, and there's some medications that have what we call a narrow therapeutic window, or a blood level which has to be within a certain range. If it goes above that, then it can be toxic. It can cause many adverse effects. So it's not only important to have the blood level up to that level where it's doing the effect. You don't want it to be so high that it causes side effects. And then, as you mentioned, the drugs can interact with each other. If you're taking a blood thinner and then you start a new drug for seizures or for cholesterol, suddenly the blood thinner medication will not be excreted as fast as it was before, and it can cause the blood to be too thin and cause bleeding. So it's really important to have one doctor or a pharmacist or whoever is really in charge of controlling the entire regimen um, be fully aware of all of the medications.
Well, and I would think too, with each ailment that comes along, that could really upset the balance. I mean, a senior gets in the habit of, they've got their pill box, they put their pills on each day, they take them 2-3 times a day,
Right.
and then something comes along and might upset the balance. So is that the time to do this reconciliation? I mean, is it critical with every new prescribed drug?
Yes, it's essential when any new drug is prescribed to do a reconciliation.
Are the pharmacists pretty well aware of each patient, in your opinion, if they would be prescribed a drug by a different physician, looking at them and how they might interact together?
Well, pharmacists are trained to do that, but they can only work with the information that they have.
Mm-hmm.
If the patient always gets his or her medications from the same pharmacy, and the pharmacist always enters them on the computer, and the program most of the time will identify potential interactions, problems, and then the pharmacist can call the doctor and suggest changes, and that's the way it should work. A lot of times patients shop around for medications. They think that some pharmacies may be cheaper for some than others, and they'll go around the city thinking that they don't want anyone to know all of the medicines that they're on.
They're embarrassed, maybe.
They may be embarrassed,
Mm-hmm.
or they may be taking pain medicines and getting them from multiple pharmacies.
Yeah.
And
we'll talk about that too, the shopping around for that kind of stuff. That is a great segue to a question from Terry, who asks, is there an easy way to find out if my parents are taking any drugs that may interact with one another?
Great question. The best way is to, first of all, you have to know what they're taking.
Mm-hmm.
Assuming that she knows what they are, that she's seen the pill boxes, she's seen the bottles, you can look and see on the bottles, are they from all the same doctor, in which case that doctor would know. If they're from different doctors, then it's important to identify the primary care doctor who needs to know all of the medications. Mm-hmm. And that's probably the best way, is to work with a primary care physician.
I would think pride might get in the way a little bit. You know,
Mm-hmm.
it'd be difficult for me perhaps to relinquish control of my regimen over to my children, and having them take a look at what I'm actually taking. Maybe there's something I never really wanted them to know that I was undergoing, or some sort of a problem that I had, a disease that I was dealing with. I would think that would add to this whole mix of confusion at times.
Well, it can. I mean, that's a family dynamic issue, which can't be underestimated, and you state it quite well. And sometimes parents and children interact openly about these things, and sometimes they don't.
So what is that easy way then, if Terry wants to say, hey, Dad, do you mind? Is it just really with a simple question? Dad, do you mind if I take a look at what you're taking?
Well, you can try that if you have that kind of relationship. That's fine. Otherwise, you could talk to Dad and say, Dad, I know you're on a lot of different medicines. It's crucial that you talk to your doctor, and he or she knows what you're on and sees the list.
I would think there would probably be a reason people like Terry would start asking these questions. They might see some side effects, or they might see some behavior that a senior is exhibiting that may not be ordinary. So that poses the question of, how do you know if it's a side effect of a medication or a disease or something else that's causing this behavior?
That's another great question. Side effects are pretty obvious when they happen right after you start a new medication. But sometimes some side effects are delayed. They don't happen for weeks or months after the medication is started. And so that's why it's important that the doctor know what the medications are and understand the potential side effects. But seniors, as we mentioned earlier, as with aging, you get certain physiologic changes. Systems slow down. Your heart functions at a different level of it has a reduced reserve capacity. Your endurance isn't as strong as it was. Same thing with just about all the body systems. The kidneys are not as efficient in removing medications and toxins from the body. The liver is a little bit slower in doing that also. The brain loses its reserve capacity, and as everyone knows who's gotten up in years, memory, particularly short-term memory, is not as sharp as it was when in earlier years. And because of the diminished in the reserve capacity, medication side effects are more pronounced. There are certain medications that can cause confusion in older people that rarely cause confusion in younger people.
They perhaps maybe, since their system is slowing down a little bit, still think they need to take this dosage. And I would think that one option might be to lower a dosage because the body is not processing that chemical the way it used to. So is that, am I correct? Am I on the right track?
Well, with some medications, that's absolutely the case, yeah. There are certain things that happen with drugs as you age. I mean, absorption is a little bit slower but it's usually completely absorbed. Most medications are completely absorbed, but they take a little longer to absorb, so that you might not notice the effects as fast. And then metabolism of the drug, how it's used in the system, can change with age. Older people can have greater sensitivity to some medications, like sedating medications, or they may be more resistant to other medications. Occasionally, there's some medications that actually you need higher doses because of different absorption levels in seniors. So it's important to understand how that works. And then excretion of medications tends to be slower and less complete from the kidneys, and it's broken. Some medications are broken down in the liver. Some are broken or excreted in the kidneys, unchanged. So medications are handled differently as you get older.
Well, I would think too that a senior citizen might be tempted to supplement if they think that their dosage is being lowered or being changed. They might think, well, I still need something for this symptom. I might try an herbal supplement or something. Do you see that happen sometimes?
Oh, it happens a lot. Yeah, and I think what you raised the issue of you're taking medications for a symptom. When that's happening, when you're treating a symptom as opposed to a disease, the ones that you're treating for symptoms are not usually as critical to take on a fixed regimen. I mean, the drug levels aren't as crucial if you're taking them for most things for symptoms, like for pain. I mean, you take a pain medicine in response to a symptom, and not so much to a condition that like hypertension or high cholesterol levels or diabetes, which the symptoms may not be as obvious. And though for certain medications, you can do self adjustment of the medication. If you have a symptom, if you have a target symptom that you're treating, that sometimes can be done perfectly well. Now, there are other symptoms that you need to adjust over time, like for example, depression. If you're a person that's taking an antidepressant, it often takes 2 weeks between a dose adjustment and a change in what the patient will feel as a symptom. So in that case, that's not a good example of something that you could take and then experience the symptom right away.
Should someone always check with their physician before they go try to purchase a supplement or purchase an over-the-counter drug?
I think in general that would be wise.
Is that more important as we get older to do?
Yes, in general, I think it would be more important. I mean, I'm not saying that any time a person wants to take a vitamin to worry about every other medication that they're taking. I don't want to appear too alarmist about it. There is common sense, of course, but every time you see your doctor and you've started a new medication, it's important to let the doctor know.
Well, and I think it too would be different for a person who's only taking 2 meds as opposed to somebody who's taking the 20 that
Exactly,
you mentioned.
exactly. And if somebody who's on an anticoagulant or on an anti-seizure medication, those would be crucial to inform your doctor about any change in over-the-counter medications or vitamins. If they're taking a diuretic and an anti-inflammatory, it's not as crucial.
How often should a senior citizen come to see you, get a checkup?
Well, if they're healthy, probably after age 65, which is the minimum for age for who we see in our clinic, although most of our patients are over 75. But most of our patients come minimum of once a year, usually 2 to 3 times a year. And if we're following conditions that need more careful monitoring, they can come in every few weeks. Mm-hmm. Sometimes when you start a new medication regimen, they'll come in every week for a while. Mm-hmm. But then it usually spaces out.
Do you always, with a senior citizen, look at their meds every time they come in?
Yes.
Is that like the #1 priority? Or?
Well, fortunately, in our clinic, our intake nurse goes over their regimen and will enter it into the computer, and that's one of the first things that happens, along with the vital signs. That's kind of standard. When their blood pressure, pulse, and temperature are taken, and they're weighed, their medication list has gone over. With new patients, we have them bring in their whole bag of medications with them, and not only the list of the ones that they're taking currently, but all the ones that they've taken in the last period of time, and we can go over them and look for potential interactions and
Are you accepting patients at the senior clinic?
Oh yes, yes. We've had several new physicians recruited this year, and
in fact, we have the largest number of geriatricians at OU Medical Center.
That's right. We have 10 physicians in our department. And 9 of them are seeing patients in the clinic. One is a neurologist who's primarily at the Veterans Hospital, but we have 9 board-certified geriatricians. And
you don't have to be referred. You can just call up and make an appointment, correct?
Yes, you can. There's a waiting list, usually around a month now. I think it used to be longer, but now it's about a month for new appointments. Because we have added our new physicians.
Okay, we're talking with Dr. Laurence Rubenstein with the Senior Center at OU Medical Center. We're asking those questions that I know that you're interested in when it comes to seniors, and we're not just speaking to seniors today. We're talking about the whole, kind of a holistic look at it,
That's right.
The whole family aspect of it too. When do you say, I'm not feeling very well, and make that appointment to the doctor's office? We hear, I'm 50, I turned 50 this year.
Congratulations.
and you know, when do I say, okay, this might be a senior issue and I need to go see someone like you?
Well, if you have a primary care physician, they're equipped to take care of you pretty much most of your life. Where a geriatrician is particularly needed is when your number of conditions gets very complicated, and also if you develop what we call geriatric syndromes that primary care physicians are not as comfortable with managing. So if you're being followed for blood pressure and cholesterol and maybe diabetes or some other chronic conditions with your primary care physician, that's fine. If you start developing issues with your memory, issues with with substantial fatigue, increased or decreased ability just to function, or you start worrying about whether you're going to be able to stay independent in your home as you age. You start functioning not as well. You have problems with your balance, with your walking ability just to get around town. Those are times when you might consider a geriatrician.
The AARP started sending me information this year. At what age do most, I know, it's really hard to take, but what age do you consider a person a senior citizen?
Well, it goes back to the days of the German Empire when Otto von Bismarck defined retirement as happening at age 65, and that kind of stuck in the mid-1800s. And then when Social Security started here, it became arbitrarily 65. There's nothing magic about 65. It's just that at that age, especially earlier, people started functioning at a lower level. Of course, nowadays we're living 10 to 20 years longer than we did back then, and so, you know, the 75 is the new 65. You know?
Right. Well, I kind of like to hear that.
Yeah.
And a lot of that is due to the medications that we're taking, correct?
That's right.
And are we finding that seniors are living healthier as well?
I think there's no doubt about it. The quality and quantity of life has increased dramatically in the past century, and it's continuing to do so. Yeah, medications are a big factor there. A lot of medications have clearly, unquestionably increased life expectancy and quality of life. Antibiotics is the easiest example, but diabetes medicines, hypertension medicines, cholesterol medicines, heart medicines, lung medicines, all of gastrointestinal medicines, cancer medicines, all of those have made tremendous breakthroughs in improving quality and quantity of life.
What do you say to those who say that even though seniors are living longer, their quality of life may not be as good?
Well, in some cases it's not. In some cases, life is prolonged and they're not happy. I mean, that's the reality. But that doesn't have to be the case in most cases. Most of the time, seniors function well, and they have autoregulatory systems, so that even if they have a lot of problems that might have depressed them when they were 40, they have an outlook that they live with these every day, and life is still good. Their spectrums change. I mean, they're no longer, you know, looking forward to dating and getting married and having kids. They're looking forward to playing with their grandchildren and seeing their grandchildren graduate from college and go on, and it's perspectives change. But one of the most rewarding things about geriatrics is just about every time a senior will come in, there's things we can do to work with them. There's always a lot we can talk about, and there's always something that we can do to make things a little bit better.
Is there a time when you kind of say, if you were 20 or 30 years younger, I would prescribe this medicine, but at your age, I don't think you need it anymore?
Well, there probably, yeah, there are some.
We hear about that as a person who's been smoking for, now this is just totally unsubstantiated, but hear about a person who has been smoking all these years and he's 80-something years old, and you hear about a physician saying, don't stop smoking. If you've been smoking this long, go ahead.
Well, we're talking individual cases. That's probably true for individual cases. There are some people who smoke all their lives and they're not affected by it, but they're rare. Statistically, people who smoke live about 8 to 10 years shorter lives than people who don't smoke, and they have a lot more chronic conditions, a lot of emphysema. The quality of life is a lot worse. And so the statistics show that stopping smoking at any age is beneficial. But there are always these examples. There's a 100-year-old guy who smokes every day
Right.
and
Drinks whiskey.
And he says that's why he's living so long. I mean, there are these exceptions, but if you look at all of the studies that have been done, epidemiologic data, those are clearly very rare exceptions.
Okay. Generally speaking, as we get older, are we going to take more medicine?
Well, not everybody, but I would say statistically, on average, yes, because as you get older, you have more conditions that can benefit from medications, which is part of the problem, because then you start accumulating medications, and so as we started this conversation talking about, it's crucial to have a physician do this reconciliation, because if you're taking, there's some medications that are sometimes you're taking a medication for your heart failure, and another one for your blood pressure, and another one for your cholesterol, and it's possible to take a single medication that will treat multiple conditions, to make it very simple. But the doctor would only know that if he knew all of the medications that you're on.
And I would think that addiction would be more prevalent as we get older. Am I wrong on that?
Well,
Or
probably.
chances for addiction?
Probably not. I think it's probably addiction does happen in old age, for sure.
We were talking about seniors shopping around.
That's right.
Going to different pharmacies.
That's right, but I think that's probably more common even with younger people.
Really?
Yeah. Older people can get addicted, particularly if they have chronic pain, or if they have a history of an addiction in the past, or if they're depressed. But probably a little less common than with younger people, but still something to consider. And we have in Oklahoma, we have a statewide computerized database that pharmacists and physicians and other healthcare providers can see whether a patient is taking medications from multiple pharmacies. But it's not the easiest thing to log on to and navigate, and unless you think to do it, you may not detect that. So pharmacies need to be proactive and check into this database, because it's a great database if you take the time to look at it.
How do I know if my mom or dad is addicted?
Well, you talk to the doctor, and there's certain signs that you would notice associated with addictive behavior.
Just kind of give hey, I'm thinking this, you might be on the lookout for this. Kind of give a red flag to the doc?
Yeah, I think that's probably the best way to do it.
Okay. Got another question here. My mom is in her 70s and never finishes antibiotics. She saves them to use them later when she thinks she is getting an infection. Is this dangerous?
It can be dangerous, and it's pretty common, because most of the time you take a prescription for a urinary infection or for a bronchitis, and you're given 10 days, 2 weeks, and you feel better after 2 or 3 days, and so you wonder why do I have to finish it? But it is important to finish it, because there are traces of the bacteria still around, and it actually may take the full recovery can take longer if you don't finish the regimen, because I mean usually doctors will prescribe not more than is necessary.
Right.
But even though you feel better, you really should finish it. Plus the fact if the medications are sitting around, sometimes they get expired and they can cause problems. There are certain particular antibiotics that have classically been associated with liver damage if they've been outdated. So it's important to try not to do that. It's very tempting, I know.
Yeah. Okay, I want to, before we wrap things up here, I want to let you know about a few things. On Saturday, August the 17th, we have our senior class, and we are going to actually go even more in depth on seniors and prescriptions. We're going to even ask you to bring some of your medicine, because we have Tammy L. Lambert, who is a specialist in poison information from the Oklahoma Poison Control Center, and she'll take a look at what you're taking and take a look at the possible interactions that are there. That's Saturday, August the 17th, and that's from 10 to 11, and the registration starts at 9:30. It's located right here where we do our chats in the Samus Education Center. That's at the Children's Hospital, and that location is 1200 Children's Avenue. You can sign up or register online as well if you go to OU Medicine Medical Center site on oumedicine.com, and you can find the senior section for that. Also, there's also going to be a new senior citizen in Edmond too at OU Medical Center. That will be located in the medical office building on the campus of OU Medical Center, and that is scheduled to open up in September of this year as well. So we've got options to be able to see it. But we, right now, we do have a waiting list, but if you want to see Dr. Rubenstein or any of the other geriatricians at the senior center downtown here, make sure you give them a call. Talk to your primary care physician, tell them that you're interested. Thank you very much for joining us. We appreciate your expertise, and this is something that more and more of us, as our population ages, is going to become more and more important to people too.
Okay, well, thank you, Scott.
We appreciate it. Appreciate you joining us today on OU Medicine Chat. We'll see you next week.